I would like to say hello to my friend Alexandre and
Hello.
my dear friend. Hello, how are you? And my dear friend Dr. Zar and everybody there. And it's nice for me, Dr. Jalal. I hope you all are doing well during this pandemic. To start about the situation in Gaza Strip, as you all know, Gaza has been residing on under Israeli blockade for more than a decade. From now, the blockade is surrounding Gaza from all of its borders. Gaza Strip is 360 kilometers, square kilometers and it's surrounded from all of its sides by the Israeli blockade, with no one entering or no one going out without being monitored. And this blockade had impacted all the ways of life, including the medical and humanitarian ways for the Palestinian citizens residing in Gaza Strip. And when the COVID-19 pandemic started, it was lucky for Palestinian people living in Gaza Strip that the blockade had postponed the pandemic in Gaza till August 2019, where the first case of COVID-19 had registered at that time at August. And after that, the curve of COVID cases started to erupt rapidly, reaching a plateau at November and December, where more than 1,000 cases had been registered a day. And to manage this situation, the Ministry of Health, with the aid of ICRC and WHO, turned the European Gaza Hospital, which is a secondary and tertiary hospital in the south of Gaza, to a COVID center. This hospital is one of the hospitals that had tertiary services for the vascular and the neurosurgical services that help more than 1 million population residing in the south of Gaza Strip. So the Ministry of Health turned this whole hospital to a specialized hospital to deal with COVID-19. Hospital configuration was for ICU and inpatient beds. And getting back to the picture that demonstrates the hospital, near the hospital, there is a school in this area. This school, this is a secondary school. Its roof has been turned to beds to aid for the coverage of COVID-19 cases. So the hospital contained for about 200 multi-level ICU beds, more than 300 inpatient beds to aid in the coverage of infected population. And as you know, the Gaza Strip population is over 2.5 million citizens living in this small area. It's overcrowded, and this helped in the widespread and rapid spread of the pandemic. The hospital based after months of the COVID pandemic, the hospital got full, and then the Ministry of Health started to initiate specialized COVID-19 departments at secondary hospitals, among other hospitals. And they took the home isolation parameters for mild cases with regular follow-up with these infected patients. And as we spoke about, the COVID-19 curve is luckily it's declining now for about 200 to 300 cases per day. When we speak about the morbidity and the mortality of COVID-19 in Gaza Strip, for the total number of cases registered, about 15,000. The active cases is 5,380. The mortality was about just 500, and when compared with the with the population, it's high. The inpatient cases at this moment is 122, and the critical cases in the ICU is 70. So when we speak about Gaza Strip, we speak more about lots and tremendous challenges for the local staff, as we know that the blockade had impacted the provision of supplies for the healthcare personnel. We had a significant lack of needed supplies. The oxygen quantities was lacking most of times that put ICU patients at risk of losing their lives. And for Surrey, the lack of community awareness and the overcrowded living cities give the curve a strong and rapid incline. So when we speak about vascular surgery services, the European Gaza Hospital, which is in the south of Gaza Strip, and it's serving over 1 million citizens, it is the only center that had the vascular surgeries in the south. The hospital north is a hospital having another vascular surgery center. So all the vascular surgery services at European Gaza Hospital had moved to another secondary hospital in Khan Yunis, Nasser Hospital, and it was limited just to urgent and semi-urgent procedures for patients who presented to Nasser Hospital. All outpatient clinics and elective procedures had been cancelled. And on the other hand, the humanitarian missions had stopped from coming to Gaza since and we had many cases who need special attention and special care. These cases are complex cases that need some expert, like the humanitarian missions, which was organized by the Balmed and the ICRC, who were coming regularly every month to in managing these complex cases. Now, none of these humanitarian missions can reach Gaza because of the blockade and of the movement restrictions. As Alexander talked about the vascular interventions for COVID-19 patients, we noticed an increased number of thromboembolic events among COVID-19 patients. And these numbers was increasing from the first case, which was registered at the European Gaza Hospital. And as all of you know that it is a hypercost, we had a special and unusual site of occlusions, arterial occlusions in the aorta, in the upper limbs, and peripherally. We did embolectomies, urgent embolectomies for about 13 cases with for younger patients who have no history of atherosclerosis, and as that was demonstrated by the imaging for these cases. The youngest patient was a male with no past medical history for diabetes or hypertension, and occlusion in the external iliac and popliteal artery, and his vasculature was healthy, and fortunately he did well. Here we will demonstrate a tragic case for a patient who presented with an infrarenal total occlusion of the aorta, and both common iliac and all of peripheral supply was occluded. We can notice here the beginning of the occlusion right at the infrarenal level, and the occlusion continued to occlude all of the aorta and its branches. This patient didn't get benefit from repeated embolectomy, bilateral embolectomy from proximal and distal aorta, and he, after each procedure, he continued to have reocclusion of his of the aorta despite strong anticoagulation using enoxaparin at a therapeutic level. This is another demonstration of a patient who had an occlusion, a partial occlusion. This part is for a partial occlusion in the external iliac, and this was for a complete occlusion of his popliteal at the other side. And of note, these patients had bilateral occlusions, most of them. About the dialysis access care, most of the dialysis access interventions, especially the endovascular interventions, was closed as the European Gas Hospital had the only cath lab in the south. We had loss of rapid interventions to restore the dialysis access function by endovascular measures, and the services was only limited to surgical care for patients, for dialysis patients who presented to Nasser Hospital. At the end, COVID-19 had a long-term impact on all health services in Gaza Strip, and this will take a long-term of recovery time, as Gaza Strip is a small and unequipped territory lacking aid, and we don't expect to receive the COVID-19 vaccine till the next year. COVID-19 is associated with arterial occlusive events, need a special attention and further investigation.
Okay.
And thank you for your listening. Thank you, my friend Alexander, and to Rafid. Thank you.
Thank you.
Thank you. Thank you.